Good day. My name is Stacy Winters, and I'm a master's student in the Psychiatric Mental Health Nurse Practitioner program at Eastern Kentucky University. Today I'm discussing in my presentation a clinical question. In persons over the age of 18 years old diagnosed with depression, how does exercise versus no exercise affect depression or depressive symptoms over 3 months in an outpatient setting? Depression is a global issue. It is expected to become the second leading disorder by 2030 amongst all persons over the age of 18 years old worldwide. Depression is also quite debilitating and will drive up healthcare costs exponentially. 4 studies were reviewed for this integrative literature review. Serta, Cervello, Coco, Vicencia used non-randomized designs studies of 82 females, average age of 32 years old. The intervention group used structured and progressive cardiovascular exercises and antidepressants 3 days a week for 45 to 60 minutes over 8 weeks, while the control trial group took antidepressants only. The results showed a greater decrease in depressive symptoms in the intervention group when compared to the control group. TOPS studied 40 males and females, average age 60 years old, in a randomized control trial. Depression was measured for all participants and ranged from mild, moderate to severe on the Beck Depression Inventory Scale. The intervention group received resistance training 3 days a week for 12 weeks, while the control trial continued to participate in activities of daily living. The results showed decrease in depression for the intervention group as compared to the control group. LeGrand studied 45 females, average age of 23 years old, in a randomized controlled trial. All participants were assessed for depression and self-esteem at baseline. The intervention group received 60 minutes of aerobic exercise 2 days a week for 7 weeks. The control group received none. Results revealed a decrease in depression and an improvement in self-esteem for the intervention group. There was no change in the control group. Ho, Chang, Wang, Shuang, Cheng, and Lao studied 52 participants, both male and females, age 18 years to 64 years old, in a randomized controlled trial. All participants were assessed at baseline for depression and were currently taking antidepressants. The intervention group received exercise for 30 minutes 5 days a week over 3 weeks, and the control group continued with their standard activities and stretching. There was a greater decrease of depression for the intervention group. Overall, all the studies showed that aerobic exercise can be quite effective for decreasing depressive symptoms. Nurses can recommend exercise to patients. Also, they can perform psychosocial assessments to learn about patients' exercise habits and develop a patient-specific treatment plan tailored to meet their needs. Studies have concluded that exercise has protective effects against depression. Aerobic exercise is recommended for 30 minutes a day, 5 times a week, to decrease depressive symptoms. Exercise can also reduce the side effects of psychiatric medications, as well as decrease related symptoms of diabetes and hypertension. Nurse practitioners can recommend exercise and the benefits of exercise to all patients in any setting. Exercises can be performed in the home, long-term facilities, inpatient treatment facilities, community recreational centers, faith-based communities, as well as schools. Thank you for joining me today.